My name is Mark Wall. I'm going to be performing a head, eyes, ears, nose, and throat and neck assessment on my patient, Daniel Powers. I do have his permission. He gave it to me earlier. I'm going to start off by inspecting the skin on his face and looking at the head and the scalp, looking for any deformities, any lesions, any discolorations. So far everything looks fine. I'm going to put some gloves on here. Then I'm going to palpate his skin and palpate his head. When I palpate, I'm looking at hair distribution, any type of abnormalities, whether the head is symmetrical. Then I'm coming down, palpating his face, make sure there's no inflammation or sensitivity or anything like that. Everything seems to be okay. Then fix it there. Then I'm gonna come down. I'm gonna assess the face. I'm looking at the facial structures, making sure it's symmetrical, no redness or swelling, anything like that. And I'm gonna come back to the eyes. I'm looking at the conjunctiva. Open your eyes, man. Looking at the conjunctiva, making sure there's no redness or swelling, and then I'm coming down looking at the sclera, or looking at the sclera, looking at the conjunctiva, it's pink, and no redness or swelling, no water eyes, no discharge, anything like that. And I'm gonna test his pupillary responses and see how that does. I'm gonna shine the light in his eye and make sure that they constrict. And I'm also looking at the opposite eye to make sure it constricts too, and it does. And so his pupils are equal round, reactive to light, and accommodating. You could also test for accommodation by taking a pen and I want you to follow my pen, like look at it close here and then look at the clock way back there on the wall. And you're also looking at for constriction. You can take the light, I'm having a hard time seeing it, but you can take the light and kind of shine over the side and look at the pen and then look at the clock against the wall back there. And what you should see, and I do see, what you should see is that when he looks at something near, his eyes should constrict, and when he looks at something far away, they should dilate, and they do. Next thing I'm going to do is check for the extraocular movements, and this is cranial nerves 4, 5, and 6. So, just hold your head straight and just follow my pen. And they do, and then I'm on chest for convergence here. When I bring my pen in, they do converge. Next thing I'm going to do is I'm going to test his visual fields, and the way we can do that is when we test for his visual fields, it's called confrontation testing, but basically we're testing his periphery and all the zones of his visual fields, and we can do that like this. Tell me when you see my fingers.
Now.
And that seems to be intact. Once we get through testing for the eyes, we can, and the pupillary responses, we can do something called the cover test. And I can ask him to, and this basically checks for any type of eye alignment to make sure the eyes are in line. But I can cover one eye, and when I cover one eye, I ask him to look at something fixated on the wall, and then when I cover it, and then I take first you'll ask him to fixate on the wall, and then when I cover the eye shouldn't move. And then you do the other eye, and when you take it away, the eye shouldn't move. Fixate something on the wall and cover the eye, and then the eye that's covered shouldn't move. So that's called the cover test. And then once we do that, we're going to look at the internal structures of the eye. using the ophthalmoscope. So what I'm looking for here is I'm looking for the red reflex, which is present, and I'm going to follow it in to look at the optic disc. And the optic disc is intact. I see blood vessels, and the optic disc is margins are clear. And I'm also looking for any abnormalities such as any swelling. But anyway, the optic disc is intact. I'm looking at the other one too and following it in. Oh, you can see it real good in this one. Anyway, it's I see the blood vessels, the optic disc, everything appears to be normal findings. Once I get through with looking at the eyes, the next thing I'm going to assess is the ears. I'm going to go to my ear exam. When I look at the ears, I'm going to palpate the ears for any redness, swelling, discharge on both sides. And I'm going to take my otoscope. Oh, I'm dropping one. Take my otoscope. I'm going to look inside the ears. I'm going to pull the ear up and back. And there seems to be no earwax, and I do see the eardrum is pearly white with a reflection. It's nice and clear. I'll go to the other side, do the same thing. Seems to be no redness or swelling, no discharge noted. Oh, and you definitely can see it, the pearly white color on it, and the white and the light reflex. So I'm done with that. Then I'm going to do the Weber and Rhine test. With the Weber and Rhine test, he should have lateralization on both sides of his ear. If it lateralizes to one side and it's not even, he could have some sensorineural hearing loss. Tell me if you hear lateralization, what you hear.
I hear it in both ears.
Evenly?
Mm-hmm.
Okay, that's a normal finding. Next thing I'm going to do is the Rhine test. I'm going to hold it right there. Tell me when you can stop hearing it.
No.
Can you still hear it?
Mm-hmm. Yeah.
Tell me when you stop.
I got good ears. It may be a while. Okay, now.
Okay, air conduction is greater than bone conduction. That's a normal finding. We'll do it on the other ear too.
Now. Now.
Air conduction's greater than bone conduction. That's a normal finding. Then we'll conduct the whisper test. Basically what I'll do is I'll cover the ear. I'll ask him to cover the ear on one of his ears, and then I'll whisper and say a word, and he should be able to hear it on the other side. I'm on.
Apple.
Okay, and he does hear it, and cover your other ear. Or I'll get on the other side.
Baseball.
That's right. So he can hear when he does cover his ears. Then we'll move on down, and before I forget, I do want to test his to see if he has any soft feeling on his face, forehead.
Feel it. Feel it.
Yep.
I'm supposed to close my eyes. So.
Yeah.
Yeah. Feel it. Feel it. Feel it. Feel it.
Yeah. And then I also want to test. I forgot to do this earlier too, but you also want to test to see if he has any corneal reflexes. And he does, which is a normal response. And I do want to, before I go on to the nose, I do want to palpate his sinuses and to see if there's any tenderness noted. Is there any tenderness?
No.
And I'll percuss it too. Any tenderness?
Feels normal.
Okay. So we do want to do that. And then once we're done with that, we want to, we've inspected the ears, no drainage, no redness, no swelling, they're both symmetrical. We've inspected the auditory canal, the tympanic membrane, and we've inspected the pinna and the tragus and all that. So we're going to move on down to the nose. When we look at the nose, we notice that its midline is straight, and there's no deformities noted on the outside of the nose. And we can palpate a little bit just to see if there's any tenderness, no tenderness noted. And we want to go ahead and shine a light up his nose. And I'm going to use the otoscope for this just to see. And I'm going to let you lift your head back for me. I'm going to look up inside the nose, and I can see hair evenly distributed. And the turbinates are intact, no redness, no swelling noted, no inflammation. So we'll inspect the nose, and in the mucosa, we notice that the mucosa is pink and moist, no swelling or discharge. And we also want to note that there's no deviated septum, and the nasal passages are patent and they're pink. And once we do that, we can move on down to the mouth, and we want to look inside the mouth and take the tongue depressor. And I also want to note that when we perform the Weber and Rhine test, that's cranial nerve 8. And when we're assessing the pupillary responses and all that, that's the optic nerve, which is cranial nerve 2. And I also wanted to mention too that we didn't talk about this, but when you're doing the eye exam, you want to check for visual acuity, and you want to have a Snellen chart, and you want to get them to cover each eye, so that they can, and get them to look at the lines on the Snellen chart so that you can see what they're seeing in both eyes, and individually and both together, to see what their vision is. If they're, like say for example, if they're seeing 20/60 in both eyes, that means that what they see at 20 feet, somebody can see, a normal person can see at 60 feet. If they're seeing 20/20, that means they got almost near perfect vision. And what they see at 20 feet, that a normal person can see at 20 feet. So that's the optic nerve 2, and the pupillary responses are optic nerve 3, and then the gaze, the conjugate gaze, and the visual fields and the ocular motor movements, that's cranial nerve 3, 4, and 6. When we do the Weber and Rhine test, that's cranial nerve 8. And we'll get into more when we assess the neck and all that. I'll get into palpating the lymph nodes, and I'll get him to clench his jaw. And when he clenches his jaw, I'm checking for the massive muscle. I'm also checking for the TMJ joint, and that'd be cranial nerve 5. So, anyway, now we're going to do the mouth exam. Take my tongue depressor. If I can get this thing to turn on. There we go. Get to open your mouth for me. Get you to open your mouth for me. And I'm looking at any redness or swelling. I'm looking at the soft and hard palate. Lift your tongue up. Looking at the parotid gland and the salivary glands. I'm also going to open his cheek up and inspect his cheek. And no swelling, no lesions noted. And stick your tongue out for me and say ah. Ah. Uvula. Say ah again. Ah. Say it again. Ah. Okay. Uvula rises with phonation. There's no deviation to the uvula. It's all midline. And we're also looking at the tonsils when we do that. And his tonsils, you can actually grade the tonsils. His seems to be grade 3, which is like the position in the mouth. And you can clearly see them. They're not swollen or red or anything like that. So that's good. That's a normal finding. His mucosa is pink. And his throat doesn't seem to be swollen, and his gums look good. Buccal mucosa looks good, pink and moist. So that's good. And then when he says ah and all that, that's cranial nerve 9 and 10 that we're assessing there. And when it rises, I think cranial nerve 8, which is what we do with the hearing, that's the vestibulocochlear, and then cranial nerve 9 is the glossopharyngeal. Also, when we do inspect his face, now that we're on it, we can go ahead and say, puff out your cheeks. Stick your tongue out, smile for me. We're checking for symmetry on both sides of the face, and you can quit smiling, it's kind of creepy. But we're checking for symmetry on both sides of the face, and the tongue is midline with no fasciculations. That's cranial nerve 12, and which is everything on him appears to be normal. Now I'm on after I've inspected the mouth, I'm gonna come on down and I'm gonna go ahead and palpate his lymph nodes. So when we palpate the lymph nodes, we're gonna start with the preauricular, the postauricular, the clench your jaw, and I'm palpating his masseter muscle, and I'm also palpating his TMJ joint. Open and close your mouth. Okay, and it seems to be normal. But anyway, once I've done the pre and post auricular, we're going to do the tonsillar, and then the submandibular. And he's got a beard, so I'm really having to press hard. The submandibular, the submental, and then we're also going to move on down to the neck. We're going to palpate the anterior cervical chain, the posterior circular chain, and we're going to come on down to do that. And it's right behind the sternocleidomastoid muscle. Then we're going to do the occipital, back of the head, and then we're going to do the supraclavicular, which is above the clavicle. And all his, I don't see any, I don't note any tenderness, any lesions, any type of masses, palpable masses or anything like that. So all his turn out to be normal findings. Now, once we do that, we're going to inspect the neck. Lift your neck up for me. Let's go ahead and do the range of motion of the neck. Go your head back, forward, side to side, and then you can do around it. There you go. And his cervical range of motion seems to be intact too. What we're also looking for is lift your back. We're also looking at the trachea to make sure the trachea is midline and not deviated, and no tenderness or swelling with the neck when we palpate it. And we can go ahead and palpate his thyroid gland. And when we palpate it, we're going to come from the back, and we should be able to, when we palpate it, the isthmus should rise when he swallows, and he's swallowing now, and I can feel the thyroid gland. Do it again. And as he swallows, I'm palpating at first with my left hand, then next with my right hand. Do it again.
There you
Do it again. Do it again.
go. I need more saliva.
Oh.
Oh.
And I can feel it. So, and there's no swelling, no goiter noted, no masses noted. Everything seems to be intact with that. Another thing I want to assess for too is, I forgot to do this with the eye, but when we want to check his eyes, when we were doing the extraocular motor movements, we want to check his eyes to try the strength to try and open his eyelids when I'm pulling pressure. And that also kind of assesses the strength, which is cranial nerve 3, 4, and 6 is 2, and that I forgot to do that. But anyway, and cranial nerve 11 is I'm gonna get him to shrug his shoulders against resistance, and that's intact. And I also want to listen to his carotid arteries for any bruits or thrills, which is very important. And you can use the diaphragm and the bell with this. And I think you hear better with the bell. And I can clearly hear pulsation on his left side. And no bruise or thrills noted. Another thing I'm going to get him to do is to turn his head against resistance. Okay, and that seems to be intact. That also assesses cranial nerve 11 as well. I think that pretty much concludes my HEENT assessment. Thank you.